My name is Adrienne Youdim. I'm a board-certified physician in internal medicine, but I'm also certified as a physician nutrition specialist and a obesity medicine specialist. So my practice is essentially treating common medical conditions through diet, lifestyle, and pharmacotherapy to address the excess weight, to address the obesity. So I did my undergraduate education at UCLA. I went to UC San Diego for medical school, came back to Los Angeles, did my internship, residency, fellowship at Cedars-Sinai, and I practiced there as faculty for about 8 years as the director of the Center for Weight Loss at Cedars-Sinai, and currently am in private practice. The definition of a disease is a physiology that is aberrant or has gone wrong. Obesity is a difficult disease to treat or to cure. It's challenging because it's not just about the treatment that is offered, whether it's diet, lifestyle, medications, or surgery, but it's also about changing a behavior in an environment that is difficult in which to change that behavior. I would consider obesity a chronic disease because it is something that needs to be dealt with on an ongoing basis. So obesity is a condition that affects every organ system from head to toe. Obesity is associated with common things that we all talk about in this country: heart disease, which is the #1 killer in both men and women, diabetes, risk factors for heart disease other than diabetes, including cholesterol, blood pressure. Obesity affects joints, it affects skin, it puts people at greater risk for cancer. In fact, the most common cancers in the United States, excluding tobacco-related lung disease, are associated with obesity. Breast cancer, prostate cancer, colon cancer, pancreatic cancer, all have associations with obesity. We know that women who have excess weight are at greater risk for infertility. If they do conceive, they're at higher risk for miscarriages, and they're at greater risk for complications both in themselves during pregnancy and in the child. Not to mention that when an individual is obese before and during pregnancy, they pass on that likelihood to their child. The refreshing news is that really modest amounts of weight loss significantly improve these medical conditions, or what we call comorbidities. So take, for example, an individual who's 200 pounds. They lose 10 to 20 pounds, which is significant but not tremendous, and as a result get their sugars under better control, blood pressure comes down, sleep apnea improves, they improve their fertility. Obesity is one of those diseases that you unfortunately wear on your sleeve. And there is a bias with the excess weight that people carry. And so, unfortunately, individuals who are overweight and obese do have a lot of psychosocial comorbidities. They do have more anxiety. They do have more depression. And these things start early. Children and adolescents who are overweight and obese have a significant degree of psychosocial issues, social isolation, and this carries into adulthood. The bariatric surgery literature shows that there's an interesting or unique dichotomy following weight loss. So as you would expect, a lot of people have improvement in their depression following bariatric surgery, but there are also a subset of patients who develop worsening depression. Perhaps people attribute so much of their problems to the excess weight, when in fact everybody has problems, right? It's a challenge to lose weight. We live in a world in which we're all about convenience. Fast food, or even if it's not fast food, it's quick food. We don't take time to eat. We don't take time to prepare, to shop, to create good nutrition for ourselves. Essentially, physical activity has been engineered out of our lives. Dishwashers, remote controls, cars, escalators, day-to-day activity that people used to do, we no longer need to do. once people develop obesity and have this excess weight, weight loss becomes difficult because the body does not want you to lose weight. So when individuals do lose weight, stomach hormones start to send messages to the brain that the person is hungry. So when people regain weight following weight loss, it's not a matter necessarily of lack of willpower, lack of control, but there is actually this physiologic drive to eat more, and that is dictated by hormones in the body.